Bacterial pneumonia is a serious and potentially life-threatening infection of the lungs that can affect people of all ages, but it is particularly dangerous for the very young, the elderly, and those with weakened immune systems. It leads to over 1 million emergency department visits and over 41,000 deaths per year. In this video, we'll explore what bacterial pneumonia is, how it develops, the symptoms to watch out for, and how it is diagnosed and managed. Hi, I'm Dr. Knapp, family medicine physician, here to bring you medical information so you can take control of your health and make the most of your doctor visits. Let's get started. Pneumonia in general refers to an infection of the lungs that causes inflammation in the air sacs or alveoli. These air sacs can fill with fluid or pus, making it difficult to breathe and causing symptoms such as coughing, fever, and chest pain. Pneumonia can be caused by a variety of microorganisms, including bacteria, viruses, and fungi. The most common cause of bacterial pneumonia is a type of bacteria known as Streptococcus pneumoniae, often referred to as pneumococcus. However, other bacteria can also cause pneumonia, including Haemophilus influenza, Staphylococcus aureus, and Legionella pneumophila. Each of these bacteria can lead to pneumonia, but they can cause slightly different symptoms and complications, and they may require different treatments. Bacterial pneumonia can develop on its own, often after a person has been exposed to the bacteria through droplets in the air from a cough or a sneeze. However, it frequently occurs after another respiratory infection, such as the flu or a common cold, when the immune system is already weakened and less able to fight off new infections. This secondary pneumonia is particularly common in older adults, young children, and people with chronic health conditions such as asthma, chronic obstructive pulmonary disease, or heart disease. The symptoms of bacterial pneumonia can range from mild to severe depending on the person's age, overall health, and the specific type of bacteria causing the infection. Common symptoms include a high fever, often with chills or shaking, a cough that may produce thick, yellow, green, or even bloody mucus, and shortness of breath. Other symptoms can include chest pain, especially when taking deep breaths or coughing, fatigue, and a rapid heart rate. In some cases, people with bacterial pneumonia may also experience confusion or delirium, particularly if they are older adults or have other underlying health issues. This can make it difficult to recognize the symptoms of pneumonia, especially in those who may already be dealing with other chronic illnesses. If you or a loved one are experiencing these symptoms, it's important to seek medical attention promptly. Bacterial pneumonia can worsen quickly, and early diagnosis and treatment are critical to preventing serious complications. Some potential complications of bacterial pneumonia include pleurisy, which is inflammation of the lining of the lungs and chest cavity, and a pleural effusion, which is a buildup of fluid between the layers of tissue lining the lungs and chest cavity. More severe cases of pneumonia can lead to lung abscesses, which are pockets of pus that form in the lungs, or bacteremia, which is when the infection spreads through the bloodstream and can cause sepsis, a life-threatening condition that requires immediate medical care. When you visit a healthcare provider with symptoms of pneumonia, the first step in diagnosis is usually a detailed medical history and physical examination. During the physical exam, the doctor will listen to your lungs with a stethoscope to check for abnormal sounds such as crackling or wheezing, which can indicate fluid in the lungs. The doctor may also ask about recent illnesses, travel history, and whether you have any risk factors for pneumonia, such as a weakened immune system or exposure to known cases of pneumonia. To confirm the diagnosis, your doctor may order a chest x-ray, which can show the presence of pneumonia in the lungs and help determine the extent of the infection. A chest x-ray is a key tool in diagnosing pneumonia, as it can reveal areas of lung that are inflamed or filled with fluid. In some cases, other imaging tests such as a CT scan may be needed to get a more detailed view of the lungs, especially if the pneumonia is severe or not responding to treatment. In addition to imaging tests, the doctor may order laboratory tests to identify the specific type of bacteria causing the infection. This can include a sputum test where a sample of mucus from your lungs is analyzed in the lab, or a blood test to check for bacteria in the bloodstream. Identifying the specific bacteria responsible for pneumonia is important because it helps guide the choice of antibiotics for treatment. The primary treatment for bacterial pneumonia is antibiotics. The type of antibiotic prescribed will depend on several factors, including the specific bacteria causing the infection, the severity of the illness, and whether you have any underlying health conditions. Commonly prescribed antibiotics for bacterial pneumonia include amoxicillin, azithromycin, and doxycycline. In some cases, a combination of antibiotics may be used to cover a broad range of potential bacteria, especially if the exact cause of pneumonia is not immediately clear. It's essential to take the full course of antibiotics as prescribed, even if you start to feel better after a few days. Stopping antibiotics early can lead to the bacteria becoming resistant to the medication, which can make the infection harder to treat and increase the risk of complications. If you have any concerns about your medication or experience side effects, be sure to discuss them with your doctor before making any changes to your treatment. I just want to take a moment to ask that you hit that like button and subscribe to my channel. Leave a comment below if you have any feedback or have topics you want covered in future videos. Anyway, in addition to antibiotics, other treatments may be needed to manage symptoms and support recovery. Over-the-counter pain relievers such as acetaminophen or ibuprofen can help reduce fever and relieve chest pain. Cough medications may also be recommended to help control a persistent cough, although it's important to use these cautiously, as coughing helps clear mucus from the lungs. In some cases, especially if the pneumonia is severe or if you have underlying lung conditions, you may need supplemental oxygen to help you breathe more easily. Rest is a critical part of recovery from bacterial pneumonia. Your body needs time and energy to fight off the infection, so it's important to get plenty of sleep and avoid strenuous activities until you are fully recovered. Staying hydrated is also important, as fever and infection can lead to dehydration, which can worsen symptoms and slow recovery. Most people with bacterial pneumonia recover fully with appropriate treatment, but the timeline for recovery can vary. While some people may start feeling better within a few days of starting antibiotics, others may take several weeks to fully recover, especially if the pneumonia was severe or if there are other underlying health conditions. It's important to follow your doctor's advice and attend any follow-up appointments to ensure that the infection has cleared and that there are no lingering complications. Preventing bacterial pneumonia is possible in many cases, and several strategies can help reduce your risk. Vaccination is one of the most effective ways to prevent bacterial pneumonia, particularly for those caused by Streptococcus pneumonia and Haemophilus influenza. The pneumococcal vaccine is recommended for all the children, adults over 65, and younger adults with certain health conditions that put them at higher risk of pneumonia. There are also vaccines available for other causes of pneumonia, such as the flu and RSV vaccines, which prevent viral pneumonia. In addition to vaccination, practicing good hygiene is key to preventing the spread of bacteria that can cause pneumonia. This includes regular hand washing with soap and water, avoiding close contact with people who are sick, and covering your mouth and nose with a tissue or your elbow when you cough or sneeze. If you smoke, quitting smoking is one of the most important steps you can take to protect your lung health and reduce your risk of pneumonia. Smoking damages the lungs and weakens the immune system, making it harder for your body to fight off infections. For those with chronic health conditions, managing those conditions effectively can also help reduce the risk of pneumonia. This includes keeping conditions like asthma, COPD, and diabetes under control with the proper medication and lifestyle changes, as well as attending regular checkups with your doctor to monitor your health. Bacterial pneumonia is a serious condition, but with prompt diagnosis and appropriate treatment, most people recover fully. If you or someone you know is experiencing symptoms of pneumonia, it's important to seek medical attention as soon as possible. Early treatment can prevent complications and help you get back to feeling better more quickly. Remember to follow your doctor's advice, complete the full course of antibiotics, and take the necessary steps to protect yourself and others from this potentially dangerous infection. Thank you for watching. I hope you found this information useful. As always, take care of yourself and make the most of your day.